Hello, my name's Ferry and I'm an occupational therapist. And today I'm going to be talking about clinical reasoning. Most of you watching will have an understanding of what clinical reasoning is. A clinical process that we go through to justify and defend our recommendations, as well as ensuring that they are fitting with the profession so that they're client-centered and holistic. So for occupational therapists, that means using all of the information we have available to maximise independence, engagement and meaningful activity whilst ensuring that they are robust. That's how I would tend to define clinical reasoning for us. The clinical reasoning process allows us to provide our patients or clients with enough information to make informed decisions, ensuring that they are truly client-centered. And that's essentially what our job is in a lot of cases. It isn't about finding the perfect answer. It isn't about saying there is a right or a wrong. And it often certainly isn't our role to say yes or no. It's about providing objective assessment, using our clinical reasoning and experience to gather all the evidence and provide an appropriate range of options for our clients who have capacity to make decisions that are the right ones for them. Within the context of bathing, my experience is that that's quite challenging sometimes. So, for example, often when I'm providing supervision for occupational therapists, or when I'm at exhibitions talking to occupational therapists about bathing, the response can be very much, we don't do bathing in my area, or baths aren't something that I consider. And I like to challenge that, because there should never be a blanket we do, we don't, yes or no. If we do that, how are we actually demonstrating client-centered practice? It seems to be, in my experience, that bathing assessments themselves have potentially become more about a transfer. And that's for myself as well, especially when I was working in an acute setting. It was, can the person get in and out of the bath? Now, that to me now is a transfer assessment, but at the time I considered it to be a bathing assessment. What it doesn't cover, that though, is why is the person bathing? So my clinical reasoning, while seeing bathing as a transfer assessment, so can the person safely get in and out, is what I miss is actually what is meaningful to that person. So why do they bathe in the first place? Why is it important to them? When I started reflecting on that, it completely changed my clinical reasoning about what I now consider to be a bathing assessment. In reflecting, I use my own experiences of why I bathe, why I might bathe my children when they've been young, to consider how could I have completed those bathing assessments differently in the past? And indeed, have I let those clients, those patients down by not asking them the why question? In asking why and not how, it allows us to build up a more robust client-centered picture of the process that person goes through to bathe, and therefore completely alters my clinical reasoning around my recommendations. For example, if I treat it as a transfer assessment and somebody is having a bit of difficulty, I might have provided them with a piece of equipment which allows them to get in and out of the bath safely. But have I considered the impact of that equipment? Have I considered whether the equipment that I'm putting in the bath is going to have a negative impact on something else that they do while they're in there? And that could be the bit that's meaningful. What I do now, certainly as part of the building up of that picture, is ask why. Why do you bathe? And I'm asking you watching, why do you bathe? And if that's to have a wash, great. Then actually the transfer assessment is a meaningful part of that task, because all you're actually wanting to be able to do is get in, have a wash, get out. If your answer to that why question is because it helps support my mental health, because I get in there and I relax, I reflect, I unwind. If the answer to that question is you get in the bath with your young children to play while they're in there, and having a wash as a byproduct, then actually what you're doing is reinforcing your roles, and that might be a really important thing to you. And that's predominantly my experience of bathing with my children when they've been young. If somebody then told me they were going to take the bath out, if I had some sort of catastrophic injury, and install a shower, yes, that would mean I would get washed and dressed. I would be clean, I would be hygienic, but it would completely change my family dynamic. It would completely change my roles. It would have a huge impact on my health, my mental health and well-being. So without asking the why question, it can't be a meaningful activity. So why are we getting involved doing it in the first place? Asking that question then helps us gather all of that information about you, about the environment, about what's meaningful to you, so that we can, as part of our clinical reasoning, provide robust outcomes that are client-centered and holistic. And that's our challenge. Thank you very much.